नमस्ते बिटिया, हमेशा खुश रहो बिटिया। A very good morning to you all. This is the series of urogenital system. Last lecture we have discussed about benign prostatic hyperplasia. We will continue the series today with a new topic of carcinoma related to genital urinary system. Myself, JV'n Dr. Ravi, Jain, Assistant Professor, Department of Practice of Medicine, Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University. In the carcinoma related to genital urinary system, we will be discussing rather two topics. Because these are small topics, very small topics. So we will be discussing these two topics today in this lecture. First of all, the prostate cancer. That is a very common indeed cancer in the cases of prostatic hyperplasia. BPH, a case of BPH that we discussed in the last lecture, can progress into prostatic cancer, prostatic carcinoma. And the second important carcinoma that we are going to discuss today is the renal adenocarcinoma. So these two cancerous conditions we are going to discuss today. Let's start with the prostate cancer. We have already understood the clinical features of BPH, what are the various clinical features, how to investigate the cases of BPH, and what is the management of cases of BPH. So today we are moving one step ahead of BPH, and now we are going to discuss about prostatic cancer, prostatic carcinoma. It is a common, not very common, but still a common cancer in the northern Europe and the USA. It is increasing in frequency. So this cancer is increasing in frequency as the age is advancing. The frequency of the carcinoma is increasing. It rarely occurs before the age of 50. So before 50 years, because there is very less chances of development of benign prostatic hyperplasia. So accordingly, there is a very less chance of development of prostate cancer before the age of 50 years. And it has a mean age of presentation at 70 years. But if we look in today's scenario, very few people are reaching the ages of 70 or 70 plus ages. So accordingly, the cases of prostate cancer are not that much common as we can think of. The prostate cancer arises within the peripheral zone of the prostate. So prostate cancer arises. Where does it arise from? From the peripheral zone of the prostate. From the periphery of the prostate cancer is arising. And it can metastasize to spread. It can metastasize. It can spread to the various other secondary places like pelvic lymph node. So the cancer from the prostate can metastasize and move into the pelvic lymph nodes. This movement occurs very early. There can be bony metastasis that this cancer can move into the bones, mainly the lumbar spine and the pelvis. These are the two major areas where the metastasis of the prostate cancer can occur. So this is again the anatomy that we saw in the BPH case. So this is the prostate gland that we have already discussed. So here the changes are taking place. Another important thing that I want to bring to your kind notice is the PSA. PSA is prostate specific antigen. This is the tubular marker for the cases of prostatic carcinoma. In every case, if an older patient is coming to you and he is coming with BPH, then we always advise the patient to go for PSA. PSA is a prostate-specific antigen that is basically a tumor marker that gives the indication that the patient is having prostate cancer or not. So 40% of the patients with serum PSA greater than 4 mg per ml will have a prostate cancer at biopsy. So before going for a biopsy, this is a safe test that could be performed to get the proper diagnosis of the case of prostate cancer. So always remember, old age 70 plus patient coming to you with the complaints of benign BPH, benign prostate hyperplasia, always go for a PSA test. What are the clinical features? What are the features from which the patient is coming to you? Case of BPH, benign prostatic, cases of prostatic carcinoma. So in the carcinoma, there is always significant weight loss. If the patient of carcinoma is coming to you, there will always be significant weight loss without any unexplainable cause. With an unexplainable cause, there is no cause for the excessive emaciation, excessive weight loss, greater than 10% in the last month. There will be other symptoms that includes lower urinary tract symptoms and indistinguishable from BPH. So there will be symptoms that are related to the BPH, because after the development of BPH, the symptoms of prostate carcinoma occurs. The symptoms and signs due to metastasis includes, if there is metastasis, for the clinical features of prostate carcinoma, first of all, remember all the symptoms and features of BPH, and in addition to that, if there is metastasis, then some other features are present that includes back pain because of the metastasis of the cells to the pelvic bones. We have already discussed the metastasis, where the common metastasis takes place. There can be weight loss, that I have already told you that in every case, every single case of cancer, there is unexplainable weight loss. Unexplainable weight loss, your mind should always divert towards cancer in the current scenario. There will be anemia. Anemia will be common, and there will be an obstruction of the ureters. The ureter will get obstructed due to the carcinoma of prostate. What are the common investigations that can be done in the cases of prostate cancer? If a patient of prostate cancer is coming to meet the common investigations that can be done. The first one you already know is PSA, prostate specific antigen. It is a non-invasive test that can be easily done from the blood examination. And in the serum, you can see the level of PSA, prostate specific antigen, that is a liver marker. And you can easily find out that which of people are susceptible for developing prostate cancer, and then for the confirmation of the biopsy can be taken for those patients. On the rectal examination, the prostate often feels nodular because the prostate lies just above the rectum. So we always do the DR, rectal examination, for assessing the size of the rectum. So it feels as a nodular and stony hard. There will be stony hardness present at the prostate gland in cases of prostate cancer. An ultrasound scan can be done for assessing the size and weight of the prostate gland. And plain X-ray of the pelvis and lumbar spine to see if any involvement of the bony bones are present or not. So plain X-ray of the pelvis and lumbar spine can be done. The diagnosis is confirmed by urine biopsy. So first of all, you just perform a PSA. If there is a doubt, you perform urine biopsy in such a case. By the histological examination of tissue removed from the endoscopic section, when needed to relieve the outflow obstruction. Now, how will you manage the case of prostatic carcinoma? How will you manage? Since this is a carcinoma occurring in very old age, so the process is not very good. But still, you have to do certain procedures for relieving the symptoms of the patient. And number one is radical prostatectomy or radical radiotherapy in confined tumors. So you have to perform a radical prostatectomy that has to be removed. The prostate line has to be removed, or the radical radiotherapy that can be given. Reducing the circulating testosterone level. You have to reduce the circulating testosterone levels either by castration or by medication. That will result in 70% initial response rate. That is a very good response rate by just reducing the circulating testosterone level. You can give the androgen receptor antagonists such as cryoprotein acetate that prevents the tumor growth of the cells. So androgen receptor antagonist should be given. Radiotherapy is useful in the localized bone pain. If there is localized bone pain, then radiotherapy can help you in that particular case. Chemotherapy, if there is greater metastasis, there is a lot of metastasis that has taken place, then in such cases, chemotherapy is the only option that is left with us. With 5-fluorouracil, cyclophosphamide, and nitrogen mustard, the chemotherapy is given for the relief of the symptoms of patients and for preventing the progression of the disease. What is the prognosis of prostate cancer? Since it is occurring in the very old age, the life expectancy of the patient with an initial finding of focal carcinoma of the prostate is normal. So life expectancy is normal. Already old age, so he will live to his maximum that can be achieved. If it is diagnosed in an earlier stage, but if it is diagnosed in the later stage, you must localize to the prostate. 10-year survival rate is 65 to 70%. But if the metastasis has taken place, the 10-year survival falls to only 10%. So if there is metastasis, then the prognosis is poor, the duration of survival is less. If the tumor is localized, the survival rate is higher. And if it is in the, we have diagnosed clinical condition in the very early stage, then the survival rate is normal. This will have a proper full life that is remaining. So this was all about prostate carcinoma. Now we come to the second topic of today's lecture, that is renal adenocarcinoma. Since these are very small topics, so I took both the topics together in single lecture. Renal adenocarcinoma. The incidence, it is more common malignant tumor of the kidney. Most common. So renal adenocarcinoma, this is the most common if we are talking about the kidney tumors, and we are talking about the most common kidney tumor, then renal adenocarcinoma stands number one rank in the most commonest tumor that is affecting the kidney. Male-female ratio is close to 1, and the age incidence is 65 and 75 years. Between 65 means it affects the older age individuals. The tumor arises from the renal tubules. So the tumor is arising from the renal tubules basically. There is golden yellow and red appearance due to hemorrhage. The tumor appears golden yellow or blue or red appearance because of the hemorrhage and necrosis. There is direct invasion of the perinephritic tissue, that is very common, and lymphatic spread occurs in the para-aortic nodes. This also metastasizes to the para-aortic nodes. What are the clinical features with which the patient is coming in with this cancer condition? The patient may be asymptomatic. Okay, so the patient can come to you without any symptoms. In 60% of the cases, the patient can complain of hematuria. Cases can be asymptomatic, means the patient is having cancer, but still no symptoms are present. In the symptoms, in 60% of the patient can complain of hematuria with no other symptoms, no other complaints. The patient only complains of hematuria. In 40% of the cases, the patient comes with loin pain. He complains of pain in the loin. 25% with a mass. People say that they are having a mass in the kidney. 15% with a triad of. There is a triad of pain, hematuria, and a mass. The fever is additional symptoms which is seen in certain cases of this particular disease. But the triad of pain, hematuria, and a mass is seen in renal adenocarcinoma. Pain, hematuria, and a mass, lump-like feeling. So what are the investigations that could be done in the cases of renal adenocarcinoma? The various investigations are ESR could be done, and it will show a raised increase in the ESR. We can see polycythemia. The disorders of coagulation can be seen, and there can be abnormal plasma proteins, and also there can be abnormal liver function test. This could be seen in the cases of renal adenocarcinoma. What is the management of renal adenocarcinoma? The most common cancer that is observed in the kidney. We can do the radical nephrectomy. Just remove the kidney, and absolute para-aortic lymph nodes. So radical nephrectomy, you are removing the kidney along with involved para-aortic lymph nodes, so that if in case there is any metastasis, both could be removed. The small tumors can be treated by percutaneously. They can be treated percutaneously by radiofrequency ablation. If there are small tumors, they can be burned out by radiofrequency ablation, or they can be removed by tissue sparing surgery or cryoablation by cold. If the tumors are of smaller size, so you can burn them out by radiofrequency. You can do the tissue sparing surgery, or you can do the cryoablation. What is the prognosis of renal adenocarcinoma? The tumor, if the tumor is confined to the kidney, then the 5-year survival rate is limited. In case of distant metastasis, if the tumor has spread to the various places, then the prognosis falls to less than 5%. So this is such a tumor, cancer that has a poor prognosis if it metastasizes to the different conditions. So this was all about renal adenocarcinoma, and today we have finished with the urogenetic system, and in the next lecture we will be starting with the neurological disorders, especially like headache and seizures and all those disorders. So it's my request that you go through the topics again of the urogenetic system. This is not a simple system, but since we are doing it on a digital platform, so we cannot do topics like we are doing in the classroom. So you have to understand the limitations, and you have to go through the books if you face any kind of problem in this aspect. The session was powered by a digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with the digital session. If you have any query, please mention in the comment box. I will try to resolve it. Thank you. So this was Dr. Ravi, Jain, and we have discussed about various diseases of the urogenetic system. Next, we will start with the neurology on the next class. This was all for now. Have a great day. Thank you.